everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. In today's session, we will discuss about the conducting system of the heart. This is the outline of today's session. What is conducting system of the heart? The conducting system consists of specialized cardiac myocytes. So it is a network of specialized cardiac muscle fibers that provide a path for each cycle of cardiac excitation to progress through the heart. And this conducting system ensures that the cardiac chambers become stimulated to contract in a coordinated manner, which makes the heart an effective pump. The conducting system of heart consists of the following components: sinoatrial node or SA node, atrioventricular node or AV node, atrioventricular bundle of His, which is further divided into two parts, left bundle branch and right bundle branch, and another one is Purkinje fiber. So first is sinoatrial node or SA node. SA node is a oval shaped region which is located in the wall of right atrium on the right side of the opening for superior vena cava. SA node produces an electrical impulse spontaneously that travels through the heart, causing it to contract. Hence, the SA node is known as the natural pacemaker of heart. SA node generates approximately 100 contractions per minute. This rate is constantly modified by the autonomic nervous system. So, the average heart rate in human beings is 70 beats per minute. Next is atrioventricular node or AV node. It is located in the lower part of the intraatrial septum, just above the attachment of septal cups of the tricuspid valve or opening of the coronary sinus. Impulse from SA node travels to the AV node via the internodal tracts. You can see in the picture there are three internodal tracts: anterior tract of Bachmann, middle tract of Wenckebach, and posterior tract of Thorel. When the impulse reaches the AV node, there occurs a delay. This is known as AV nodal delay. Without this delay, the atria and ventricles would contract at the same time and blood would not flow effectively from the atria to the ventricles. The cells of AV node normally discharge at about 40 to 60 beats per minute and are called secondary pacemaker of the heart. Next, coming to bundle of His. It arises from the inferior part of the AV node and passes initially along the right side of the interventricular septum. You can see in the picture, then it divides into two branches, right bundle branch and left bundle branch. Right bundle branch passes along the right side of the interventricular septum and ultimately connects with the Purkinje fibers. Left bundle branch pierces the membranous part of the interventricular septum and appears on the left side of it. Then ultimately it divides into left anterior and left posterior fascicles. These fascicles connect with the Purkinje fibers and the intrinsic rate of bundle of His is 20 or less beats per minute. It takes about 0.03 to 0.04 second for the impulse to travel from the bundle of His to the ventricular muscle. Next, coming to Purkinje fibers. Purkinje fibers are located in the ventricular wall. During the ventricular contraction, the Purkinje fibers carry the contraction impulse from both right and left bundle branch to the myocardium of the ventricles. Purkinje fibers have an ability to produce contractions at a rate of 15 to 40 beats per minute. So when SA node and AV node fail, Purkinje fibers serve as the last pacemakers. Let's summarize the conducting system. SA node is a spontaneous source of cardiac impulse. It initiates an impulse which rapidly spreads to the muscles of the atria, making them contract. The AV node picks up the cardiac impulse from atria and conducts it through the atrioventricular bundle and its branches to the walls of the ventricles. The papillary muscles contract first to tighten the chordae tendineae, and then the contraction of the ventricular muscle occurs. The conducting system of the heart is supplied by the right coronary artery except a part of the left branch of the AV bundle which is supplied by the left coronary artery. And any defect or damage of conducting system causes cardiac arrhythmias. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for Nurses. And for any queries or for any suggestions, you are most welcome to comment. Thank you for listening.